Media conference with Lal Goel, which is brought to you by V4NEWS, Global TV, Malnadu TV, News Gaon Se, Samvad Sarokar News, Organ Donation India Foundation, and Gyan. Our endeavor is to enlighten you all about the impact of COVID-19 and other current subjects. But today, our topic is very important, which is concerned with almost every household, and that is healthy diet during COVID-19. It is not a diet, it is called eating healthy. The notion of diet simply defines the range of food we eat of any kind, shape, or form. However, our natural and socio-economic environment has led the general public to understand the term diet as something restrictive, namely as a method for losing weight. The ancient Greeks and Romans already understood that food and physical exercise influence our health and our weight. The Greek dietia, from which the word diet is derived, referred to a whole way of living focused on self-control and eating in moderation. A healthy diet is one that helps maintain or improve overall health. A healthy diet provides the body with essential nutrition, fluid, macronutrients, micronutrients, and adequate calories. A healthy diet may contain fruits, vegetables, and whole grains, and includes little to no processed food and sweetened beverages. The requirement for a healthy diet can be met from a variety of plant-based and animal-based foods, although a non-animal source of vitamin B12 is needed for those following a vegan diet. Various nutrition guides are published by medical and governmental institutions to educate individuals on what they should be eating to be healthy. Nutrition facts labels are also mandatory in some countries to allow consumers to choose foods based on the components relevant to health. And to discuss the healthy food during COVID-19, we have a very, very elite, educated, and experienced panel with us. I would like to invite my first guest. She is Dr. Madhu Goel. Dr. Madhu Goel is the Bariatric physician at Center for Metabolic Surgery, Mumbai. Welcome, Dr. Goel, on our show. Dr. Goel, we would like to know, because everyone today is talking about the health because of this coronavirus or COVID-19. And because of the health and the lockdown, everyone is inside the house, or they are going for the restricted time outside. And the main concentration on the health. And when the main concentration on the health, then definitely the healthy food component is there, because the restaurants are closed in many of the states. So everyone is having food at home. So we would like to know from you the healthy food during COVID-19. Dr. Madhu Goel, please.
Thank you for inviting me for this program. And I would like to say at the outset that I would like to congratulate you for, conducting these programs, which are so useful to people at large and to society. And as you have explained so well, today's topic is so relevant to each one of us. There are a few points which, I would like to highlight before, focusing exactly on healthy diet, that during COVID times, we all have become aware that the COVID infection is more, severe, or the risk factor is more in those people who have other diseases along with the COVID infection, like maybe, diabetes or obesity or cardiovascular problems. Now, if we talk of diabetes, we have a very large percentage of our population which is diabetic. Around 20% of population in India is diabetic. Prevalence is still higher in South India, more so in Kerala. Uh, More than this, there are double the number of people who are pre-diabetic as well. And amongst these diabetic population, at least half or more is overweight. Even people who are normal weight don't have a favorable body composition. So they have less muscle mass and higher fat percentage, which predisposes them to all these metabolic diseases. Now, most of these diseases can be better managed with a healthy diet. So healthy diet is not something which only builds up immunity, but it should be able to help these people as well who are at risk. So it should help people lose weight, it should help them in controlling their sugar levels as well. And the good part of this pandemic has been that everyone has become very aware of health, their diet, the associated diseases. So this is the right time to discuss these issues. And as you have very well said that lockdown period or restricted movement has given has shown a mirror to people, because people have been eating at home. So if they have gained weight during this period, they need to reflect on that, the diet maybe that's cooked at home, or the food choices, or the foods which are available at home, they need to be improved.
Yes, okay. Thank you, Dr. Goel, for giving your opening remarks. And you have mentioned very clearly that, yes, because of the COVID-19, the focus is on health. And you said that in India, the COVID-19, because India, we have lots of diabetic patients, about 20%, according to Dr. Goel. And she says that the pre-diabetic is double the 20%, it means almost 40%. And she says the South India is having more diabetic number of patients, especially Kerala. And today we have someone from Kerala, our guest, so we will discuss that point also from her. And you say that because of that, and the patients are obese. 50% of the patients are obese because of this reason, and that's why the problem is more severe in India. And to control all these things, we should have a healthy diet, to keep in mind that about the diabetes and obesity also. Thank you, Dr. Goel, for giving your own opening remarks. Now I would like to invite my second guest. She is Dr. Prerana Hegde. Dr. Hegde is bachelor's in naturopathy and yogic sciences. She is also MSc DFSM. She is the senior dietitian KS Hegde Charitable Hospital, Mangalore. Welcome, Dr. Hegde, on our show. Dr. Hegde, you just heard what Dr. Goel said, and she said that because India, the severity is that we have other diseases, and especially the diabetes, obesity, and cardiovascular diseases. Now, she has also mentioned in South India, diabetes cases are more, and you are from Karnataka. Definitely, you can explain that also. But we would like to know from you the healthy diet during COVID-19. Dr. Prerana Hegde, please.
Thank you, Goel sir, and thank you for inviting me and giving this opportunity to share my knowledge on healthy diet during COVID, which is very, very necessity at this time. And I do agree with Madhu ma'am that yes, Karnataka, the south side, is actually having increased risk factor for COVID-19, as South Canara people are having a staple food like rice, and all the from morning to the night, staple food are made up of only rice items. So maybe the increased intake of carbohydrate is one of the factors, and that is why obesity is higher on this side. So when you have a lot of simple carbohydrates, you tend to increase your body weight, and that is why the other complications like diabetes and hypertension and cardiovascular disease are also increasing, and this is why COVID-19 is increasing in South area. Yes, I do agree with having a well-balanced diet more than just saying a diet. Balanced diet, which actually improves your immune system and thus helps your body to fight against the infections. So, what I do say to everybody is have a well-balanced diet, have a carbohydrate count. That's whatever you're taking, you should have a count on it, and more of junk food has to be reduced, and locally grown products, or locally grown vegetables and fruits intake, and a lot of water. You have to prevent yourself from dehydration. The dehydration process is very, very much necessary in COVID-19 cases, and that is what I do want to say in this platform. And well balanced diet is most important one.
Okay, thank you, Dr. Hegde. And according to Dr. Hegde, she also agrees with Dr. Goel that yes, the diabetes is a problem, and in South India, this is more, and especially she gave the example of South Canara, that is the Mangalore district. Here, because people are taking more of the rice, so that's why they are more prone to the diabetes. And she says that in this situation, we must balance our diets, we must control our carbohydrates, and we should see that our diabetes should not be there. Otherwise, we can have other diseases like cardiovascular and others. Thank you, Dr. Hegde, for giving your opening remarks. Now, I would like to invite my next guest. She is Miss Amenah Malek. She is a master's in clinical nutrition and dietetics. She is CMS Wokhard Hospital. She is in CMS Wokhard Hospital, Mumbai. Welcome, Ms. Malik, on our show. Ms. Malik, you have heard what Dr. Goel and Dr. Hegde has mentioned. Now, Dr. Goel said that all these diseases, because of the COVID-19, the main problem in India is the diabetes, the obesity, as well as the cardiovascular and other disease. And she says that unless we will not control this through our diet, we cannot control the COVID in proper way. Dr. Hegde said that yes, in South India, which Dr. Goel has mentioned, and Dr. Hegde endorsed it, in South India, more diabetes because of the diet here. Everyone is from morning to night eating rice and junk food, etc. So she says that one should avoid junk food. One should have control on the all those things which are increasing or which are increasing our diabetes. So she, according to her, the diet control, the healthy food is must if we have to decrease our COVID-19. We would like to know from you the healthy diet during COVID-19. Ms. Malik, please.
Thank you so much for inviting me. Thank you so much, sir. How Dr. Madhu had said, she rightly said that, in Karnataka, that is the reason, and how Dr. Prerana said that their staple diet itself is rice. So one thing that I want to say is, the coronavirus pandemic has changed a lot about the modern life, not just, how we work, how we socialize, and how we eat. Dining out is a distant memory anyway now. One thing that Dr. Prerana said was absolutely right about eating rice. Now, I want to mention that not because rice is not high in fat, it is almost as the same as wheat flour, that is the atta. But then the main reason is because the glycemic index of rice is high. That is the reason why people are more obese at that side. Well, while all the groups are affected by the COVID-19 pandemic, especially the elderly, are those who are having the underlying medical conditions are at the greater risk. The high rate of consumption of saturated fats, then sugars and refined carbohydrates, and as Dr. Prerana rightly said, that is a simple carbohydrates. That is one reason which is, contributing to the prevalence of obesity and type 2 diabetes as well. Now, consumption of, all of these saturated fats and all your junk food, all of these are just, it activates the innate immune system and impairs the adaptivity of immunity, which leads to the chronic inflammation. Furthermore, like how what Dr. Prerana said about a well-balanced diet is absolutely right. A person should not actually, focus on how much are they eating, what are they eating. That is absolutely fine. But they don't need to, follow a specific diet as such. A healthy, balanced diet, just a diet modification is what is needed in the diet. Like, eating all your healthy carbohydrates, your healthy fats, that is your mufa, which is in your healthy fishes, then etc. So I completely agree with Dr. Prerana regarding, like she rightly said about the well-balanced diet. One more thing I want to mention is that, just because of this pandemic, people have stopped eating outside, and not necessarily the homemade food that they're eating is healthy. My point to it is, what ingredients are you using, how much oil you're using, what type of oil you're using. All of that also, comes in factor, which affects the healthy diet. Just because you're eating at home doesn't mean that you're eating healthy. What are you eating is what you have to look into it. So that's my call on.
Okay, thank you, Miss Malek, for giving the details, and she also agrees with Dr. Goel as well as Dr. Hegde that yes, because of the diabetes and obesity, the COVID-19 cases are more in India. And she says that for the staple diets like rice in South India, one has to be careful, one has to control, one should have the healthy diet. But she says, she also added that just to say that nowadays we are not going out for the dinner or food and we are taking at home, it doesn't mean that you are eating healthy food. You have to see what are the ingredients as well as which type of oil you are using and how much quantity you are using. So all these things are very important for the healthy diet. Okay, thank you very much, Ms. Malik, for giving your opening remarks. Now I would like to go to Ms. Ayyar. She is our next guest. She is Ms. Remaya Ayyar. She is MSc FSMD. She is senior dietitian, NS Cooperative Hospital, Kollam. Welcome, Ms. Ayyar, on our show. Ms. Ayyar, please unmute yourself. Please unmute. You have heard what Dr. Goel, Dr. Hegde, and Ms. Malik has mentioned. Dr. Goel said that in India, the COVID-19 effect is more because we have more cases of diabetes, and that's why obesity is there, cardiovascular diseases are there. And she says that more diabetic patients are in South and especially in Kerala. And you are from Kerala. Okay, so we would like to definitely know your views about that. And what Dr. Hegde has mentioned, that yes, in South India, because the staple diet is rice, and from morning to night, everyone is eating rice. That's why this is the reason of the more cases of diabetes here. And that's why in South India, now more cases of COVID-19 are there. Although Kerala, initially there were no cases, Kerala became the example, not only for India, for the world, but now the scene is changing, and again we have to. And what Ms. Malik said, that okay, everything is fine, but if you just think that you are not eating out, doesn't mean that at home you are eating healthy food. You have to see the ingredients, you have to see the quantity as well as quality of the food, the raw material which we are using to prepare your food. So all these things are important to control your diabetes or obesity, then only you can be saved from the COVID-19. Now we would like to know from you the healthy food during COVID-19. Ms. Remaya Ayyar, please.
A very good morning to all, and thank you very much for giving this wonderful opportunity to me. And I am agree all our panel members. But at the same time, there is so much changes that occur in our dietary habits and lifestyle. At the same time, there is in the nutritional point of view, there is a positive and negative impact is there. What I said means, the positive aspect means the most of them are at home and started to eat from home rather than that of junk food. and also we get more time for time, and we are started to eating together. So that will affect our kids' dietary habits also. They are started now eating more vegetables, colorful vegetables and fruits. That is the benefit part of this. And also we are more concerned in, especially in Kerala, we are more concentrated on kitchen gardenings and the microgreen cultivations like that. And all we all know that these microgreens are abundant in nutrients. So this period that also very helpful to us. And also we are moved to organ, so organic food. So all these are the benefits, health benefits. At the same time, the previously mentioned that the negative part is we all are get time, and we all are starting to cook and spend more time in kitchen, especially for special cooking. And in Kerala, especially, we have so many tasty and yummy snacks like what we call is vada, parampudi, like that items. All these are very fatty, and at the same time, all these items are filled with a refined spirits like that. So this will lead to obesity and overweight among the people. And we all know that this obesity is the risk factor for cardiovascular diseases and diabetes like that. So this is the negative impact of this COVID, and some positive also we get. But so we have to concentrate to follow a balanced diet. That is the main thing. If the because if we follow a balanced diet, then we can improve our boosting of our immunity also to fight against this virus. In the case of immunity, we know that 70 to 80% of our immunity is from our gut. So we have to follow a balancing diet to get this immunity, and this is not happen overnight. This will happen through a constant and regular follow-up of a healthy diet. So I also like to give some tips to how to follow a diet and thereby improving our immunity. So we have to include more prebiotics and probiotics in the diet, and the vitamins like vitamin A, C. All these are very good for improving our immunity, and protein also very important. In the case of protein also, what we said early in the carbohydrate, and the same thing for the protein intake. While we discussing about the protein intake, most of them are concentrated on the quantity, but it is important rather than the quantity, the quality is important. So we have to include, cut short the portion size and include all the high biological value proteins along with our diet. All these are helping us to improving our immunity also. So follow a balanced, regular diet, and no need to skip any diet. And especially this period, don't whatever the diet you follow, you just follow that diet. That is no need to go for the weight reduction diet, especially the special weight reduction diet like the intermittent diet. Like that diet during this period, I think that is not good. Whatever the diet we follow, you have to follow that diet in a balanced way. That is very nice.
Okay, thank you, Ms. Ayyar, for giving the details. She agrees that yes, in Kerala, because they have lots of yummy food. I think I should visit Kerala soon. And there says that's why the obesity and the diabetes, as well as other diseases are there. And but she says that the positive aspect of the COVID-19 is now the public in Kerala, or the people in Kerala are doing the kitchen gardening, having their organic foods. And this is the positive side. But she says the negative side is that so much virus is coming, and because of the diabetes, high cases of diabetes, there is a problem. But she says that this during this time, no one should go for a special diet. Only thing is, whatsoever you are eating, you control the diet. It should be healthy, but it should be a proper control, not that you are eating too much. And that's why she says, don't change the diet drastically at this time. Whatsoever you are eating, you have following whatsoever diet, but it should be in control, so that you will not suffer from COVID-19. Thank you, Ms. Ayyar, for giving your views. Now I would like to ask Dr. Goel. Dr. Goel, during COVID times, many people are taking vitamins, etc., to boost immunity, because everybody says that the main thing is immunity. And if your immunity is good, then whatsoever, if even the COVID-19 affects you, it makes hardly any difference because you are having good immunity. So during COVID-19, many people are taking vitamins, etc., to boost immunity. Are they safe, or can these be obtained through normal diet? Can you just explain this, Dr. Goel, please?
Yeah, so this is a wonderful question, Mr. Goel. As the name suggests, supplements are something which are in addition to a healthy diet. So, as all the panelists have agreed that the mainstay is a balanced diet, which includes, a variety of fruits and vegetables, maybe in different forms, in different smoothies or soups or different types of salads as well. And for diet, I would like to add, 2 points before I move to the supplement thing, that, a lot of people eat fried foods and they try to reuse the oil. So, a lot of toxins are produced on reheating oil. So, this is even followed at home. So, this is not, good practice because, it affects the body in a harmful way. And moreover, there is a lot of, usage of refined flours. So, refined flour is also stripping, uh, the grains of the important nutrients, the vitamins, the minerals, etc. So balanced diet is most important, but building immunity, as said earlier, is a gradual process. So it will take time. So deficiencies, as you said, of vitamin B12, vitamin D, iron, etc., are very common in our population. So if there is deficiency, definitely supplements are required to correct these deficiencies faster. So it's advisable that people should get regular blood tests done, and under medical advice they should be taking these supplements. Moreover, if we talk of specific supplements, then calcium, food sources of calcium are very good. So, nuts and seeds. When I talk of seeds, sesame seeds, which is, widely used in our country, or leafy vegetables or dairy are a very good source of calcium. And vitamin D, so I'm sure everyone is reading that for some period you should be going out in sun. But if there is deficiency, then definitely you should be taking supplementation of vitamin D. Moreover, a multivitamin, taking a good multivitamin for people who are above 40 years of age, or younger people who have other diseases, it's a good idea to take a multivitamin because it will cover a lot of vitamins and minerals overall. Talking of safety, I have one point to make, that a lot of people have started taking vitamin C supplements. Vitamin C can also be taken adequately from food. If you have symptoms of flu or viral infection, you can take vitamin C. But people who have kidney issues, who have history of kidney stones, etc., they should not take vitamin C supplements on their own. So yeah, this is all I would like to say, that both good diet and supplements as required can help a person have adequate nutrition.
Okay, thank you, Dr. Goel. And according to Dr. Goel, yes, in India, because we have some deficiencies of vitamins, whether it is C, vitamin A or C or D, She says, yes, if we can get it from our normal diets, because we have lots of leafy vegetables, we have leafy vegetables, we have other sources for vitamin C, then we need not to go for the supplement. But yeah, if it is less, then yes, you can go, but under the medical supervision. And she also mentioned that the supplements can harm also, like if you are suffering from kidney problems or kidney stones, then taking vitamin C over and above your food is not correct. So it is better that you should consult the doctor, get your blood checkup, see where is the deficiency, and go get those deficiency only if the doctor advise. Take those supplements, but don't take the supplements with your own. It means that everything, any medicine which we are taking, we should consult a doctor, and that only the doctor, if he advise or she advise, then only we should take the supplements, because they may harm our, we think that it is going to increase our immunity, but sometimes it happens that they can harm in other way. So one should, I appeal to all the viewers, as Dr. Goel has mentioned, that whichever supplement you want to take, please consult a doctor first and then take the supplement. Don't just go from the media reports or WhatsApp reports and take the supplements whatsoever you want to take. Thank you, Dr. Goel, for giving this valuable advice. Now I would like to go to Dr. Hegde. Dr. Hegde, you have done in naturopathy and yogic science, the doctorate. Now, I would like to know from you, Ayush Ministry and many others have come with recommendation of various natural methods like ginger, hot water drinking, etc. to avoid COVID. What are these measures, and has any study been done on their effectiveness?
Yeah, very good questions, Dr. Goel. Ayush has taken a lot of measures during the COVID-19 in preventing and this pandemic. I do agree with the natural medicine, as I am a naturopathy physician, and there are a lot of studies been going on, and many studies have been proven to have got would say effect on the natural medicines against COVID-19 by improving the immunity in your body. And as already Madhu ma'am said, that taking vitamin supplementation has got a counter effect on your body. So you already have lot of vitamins, micronutrients and macronutrients which are naturally available from the fruits and vegetables. So people, if they move on to the natural diet, that is taking a lot of fruits, vegetables, it may be on nuts, it may be a oil seed, the locally available oil seeds, like as Madam said, the sesame seed, that's a black tail and white tail, which has got high in calciums and omega-3 fatty acids. So this may actually improve a lot of immunity in your body, and it gets a host to fight against the flu or the viruses. So I do agree that the natural medicine is one of the utmost important factor. And I do want to put one point in this is like during COVID-19, the stress level in the person is increased. And so there will be a release of stress hormones, and then this may impair in your other bodily functions and mainly lack of sleep. So, going for natural relaxation techniques like de-stressing yourselves in a form of meditations, yoga, and pranayama will actually give a lot of benefits in fighting against this pandemic. So I tell all viewers that move on to the natural way of living, change your lifestyle, and start de-stressing yourselves and stop watching all the media, news regarding COVID-19, which makes you more anxious and the anxiety level is increased, which is again impairing your body functions. And the other utmost important thing is that for all these things, we need a good gut microbe. So the absorption of all the nutrients are from your gut microbe. So the more of vitamins and minerals, the zinc, whatever the now everybody is stressing on the zinc. These all items are actually available naturally in your nuts, then green leafy vegetables, fruits and vegetables. So move on to the natural diet. You actually be very healthy and fit and fine.
Thank you, Dr. Hegde. And according to Dr. Hegde, yes, the Ayush Ministry has done lots of work on this, and the researches are on. And but whatsoever has been done, it is proved that the natural way of treating the COVID is better, because to increase the immunity, not the treating, but to increase the immunity, the natural thing is better, like taking leafy vegetables, fruits, nuts, and that they will provide all the requested vitamins like vitamin A, C, or D, or even zinc. So everything we are getting from our natural things. So no need of going for supplements until unless advised by the doctor, as Dr. Goel has mentioned. And according to Dr. Hegde, that the main problem in the immunity is the stress, because right now people are very much stressed due to the COVID-19. And to de-stress that, one should go for meditation, yoga, or pranayam, etc. every day. If you will do that, then the body will be de-stressed and you will get proper sleep. And that will increase the immunity. So according to her, one should adopt the natural ways. Natural, we have all the vitamins available in the fruits and seeds and leafy vegetables, etc., or the milk. So we can go for that instead of going for supplements or extra thing. Like according to her, everyone is testing nowadays for the zinc. Zinc is also available in the, yes, I know that there was a program earlier I had done, and the doctor said that like papaya seeds, one can have this zinc, so one can go for that. And watermelon seeds is the source of this zinc. So thank you, Dr. Hegde, for giving your valuable advice. Now I would like to go to Ms. Malek. Ms. Malek, you are in bariatric and you are nutritionist in that bariatric. So I would like to know, obesity has been found to be a high risk factor for COVID. This researchers have come out that the main reasons are obesity and the diabetes are the main reason, and of course the age and the cardiovascular disease. So when obesity has been found to be a high risk factor for COVID, and you work in a weight loss center, what can be a safe weight loss diet for someone planning to 5 to 10 kg?
I'm sorry, sir, your voice was breaking. Could you repeat your question, please?
Okay, I will just repeat again. Obesity has been found to be a high risk factor. Are you listening me now properly?
Yes, sir. Yes.
Yeah. Obesity has been found to be a high risk factor for COVID, and you work in a weight loss center. What can be a safe weight loss diet for someone planning to lose 5 to 10 kgs?
Okay, that's a very good question, sir. As all these years throughout our education, we have always been taught, and I've actually personally even experienced that a healthy weight loss in a month, if a person is not going for any, surgeries or anything like that, if they just want to lose weight with your diet and exercising, so a healthy weight loss is half to 1 kg a week. So say in a month, 3 to 5 kgs is absolutely fine. Whereas when you go for obese people, it is, they are at a higher risk of having, other diseases as well, where they are having sleep apnea. They can't even, walk 3 to 5 steps. They feel breathless. So what they need to do is, since I work in a bariatric setup, it has really, helped me learn really well that, there are a few set of people which they really need this surgery for their further lifestyle changes, because it becomes very difficult for such heavily obese people to lose weight naturally. That is just with physical activity, because they are not really able to work out as well, unlike the non-obese people. So where it comes to losing 5 to 10 kgs, keeping a good check on what they are eating is also very important, because what according to their hunger, basically their hunger is more than a non-obese person. So what they eat, they need to expend the same as well at the same time. So they need to keep a proper check on, healthy food habits, like healthy cooking methods as well. Like they can opt for baking, they can opt for, grilling or steaming or shallow cooked food rather than having deep fried foods. I hope that answers the question, sir.
Okay, thank you, Ms. Malik. And what she says is that yes, obesity is a main factor for the COVID-19. And she says because it is easy for others to lose the weight by controlling the diet or having the healthy diet, but it is not easy for the obese persons to lose the weight naturally without the surgery. But she says if they want to, then they should take proper care, and they must see to it that the food should be of that such type of food which will not increase their weight, rather decrease the weight. And she is very much clear that the obesity is a main factor, one of the main factor for the COVID-19. So one should be very, very careful as far as the disease is concerned, COVID-19 is concerned. Losing 5 to 10 kgs a weight in a month is fine, but we have to be very, very careful by seeing the intakes and see what we are eating. Thank you, Ms. Malek, for giving your views. Now,
I
my
would
question
like
to
to add, Mr. Goel, 1 or 2 points, if
yes,
that's
yes, please.
okay.
Yeah,
So,
yes.
since, we were discussing weight loss diet, I have, 1 or 2 points, observations to make that, portion controlled eating is very important. The feeling of fullness takes 20 minutes to, reach the brain after you are full. So maybe, what you are eating in the last 20 minutes is not required. So one of the way is that you eat less, to help you eat less in the last 20 minutes, we advise that people should eat very slow. And, maybe, they should reduce their portions by 20 to 25 minutes. They may still be hungry when they stop eating, but eventually they'll get, satiety. So portion controlled eating is important, and, proper focus on protein and fiber, because protein and fiber will give them satiety, and, it will not make them hungry again and again. So, I just wanted to add these 2 points.
Okay. Thank you, Dr. Goel, for adding that we should understand one thing, that our brain receives the fullness only after 20 minutes, that we feel that our stomach is full. So that's to reach to that 20 minutes, one should eat very slowly so that the brain will get the signal that now, yeah, our stomach is full. Otherwise, if we eat fast, we will feel more hungry, we will be hungry, but otherwise it is full as far as the stomach is concerned. Number 2, she says that the protein and the fiber is very important in your diet. So if we will add those things, we will see that our diet is full of proteins and fiber. It will be helpful for reducing the weight and making us, keeping us healthy, so that the COVID-19 will not affect much. Thank you, Dr. Goel, for adding what Ms. Malek has said. I would like to go to Ms. Sayar. A major risk factor for COVID, which we have already agreed and you have already all discussed. And South Indian states have very high diabetes. This also we have discussed. But what precaution a diabetic person should take to keep blood sugar under control besides medicine? Because right now the problem is that everybody, mainly many people, are inside because of the lockdown. And at this juncture, what precautions, and many things are happening, that proper exercises are not taking place. You cannot go for walking in many of the states. You cannot go out for running or jogging. So in that case, we have to control, if we have to control our blood sugar, what are the, apart from the medicines which we are taking, anything, any particular diet or anything, precautions which we have to take so our blood sugar will be under control? Ms. Sayar, please. Please unmute. Please unmute. Ms. Sayar, please unmute.
Yes, yes. Sorry.
Yes,
Sir.
please.
For the control of diabetes, there is a 4 pillars. The first one is the medicine, ultimately the medicine. And the second one is the correct follow-up. and the diet, exercise. These are the 4 pillars which will help to control our diabetes. So the first 2 parts, the follow part, medical part, and the second is the diet and exercise. In the part of diet, the very thing is the timing of the food consumption. That is very important. If we follow a 3 main meals plus 3 in between, 2 or 3 in between meal, that is the very nice for controlling our sugar. For example, we have to take, there is no fasting and feasting for diabetes. So we have to take a controlled portion size, breakfast, lunch, and dinner. Along with this, we have to take an in between meal between breakfast and lunch, and also the lunch and dinner and the bedtime also. And for the concern of nutrients, we have to take complex carbohydrates in your diet. The complex carbohydrates like the whole grain, cereals, like that items, and we have to avoid the refined sugars, refined cereals, like that items. And strictly, we have to include minimum 5 servings of vegetables per day. That is very important. And also, even though we have a high blood sugar, strictly we have to, especially in this period, we have to include minimum 1 serving of fruit per day. But the thing is, we have to take the fruits as fruits, not in the form of juices and like that. And these fruits have to include as a in-between meal. That also help to avoid the hypoglycemic effect also the uh, patient, because during this time they most of them are very much conscious about our diet, and at the same time we are very anxious. So in the case of diabetic patients, there is a chance for hyperglycemia and also the hypoglycemia. So we have to follow a regular diet, a 3 main meal system plus 2 in between meal, and we have to include 5 food groups in our diet. That is, we have to include complex carbohydrates, proteins, and fibers like fruits and vegetables, all these. And in the case of non-vegetarians, we have to use fish, egg white, or a lean meat like that. So include all the food groups in the diet, but the portion size is very important. No need to take too much of foods. A small quantity food, that is very important. And the other thing is hydrate. We have to be hydrated daily. That is also very important. Even 2 liters of water per day is also important. All these we have to take. And the other thing, these are the main things diabetic patients have to concentrate on.
Okay, thank you, Ms. Iyer. And according to her, there are 4.
There is 1 point also. Definitely try to avoid these fat fried items. That also very important. For the snacks, it is better to boil the vegetables or boil the pulses. That is good for snacks, or otherwise sugar-free biscuits and like that items. No need to go for the deep fat fried items.
Okay, thank you, Ms. Iyer. And according to her, there are 4 pillars for the control of diabetes. That is, first is medicine, second is follow-up, third is fiber, and fourth you mentioned, what you mentioned, Ms. Iyer? Exercise. Okay, so these are the 4 pillars. Medicine, so one has to take regularly, the follow-up has to be done. But she says the main thing is the diet and the exercise. And that for the dieting, one should take more leafy vegetables, fruit, as well as there should be a 5 times a meal, which 3 meals which are regular meals, breakfast, lunch, and dinner, and 2 in between, between the breakfast and lunch, as well as between the lunch and dinner, or if possible, even at that bedtime, we should eat. We should not keep ourselves free, without food in our stomach, but portion should be controlled. We should not eat much. And she also added that no fried things to be taken. If you want to eat any snacks, please go, boil it and then take it, but don't have a deep fry snacks at all. And this can control your sugar, apart from the medicines and the exercise which are required. Anything you want to add, Ms. Iyer? Is it fine what you have said? I've summarized. Is it okay?
Is it okay? 1 serving
okay.
fruits and 5 servings of vegetables also added. That also.
Yes. So thank you, Ms. Ayyar, for giving this very valuable advice. I'm sure those viewers who are suffering from diabetes or pre-diabetes, they must follow this, because the COVID-19 is affecting very much to the diabetic patients, and one has to be careful. And diabetes leads to other diseases, which we all know. Now I would like to go to Dr. Goel. Dr. Goel, what is healthy eating? What should a person eat to avoid infections? And especially now we are talking of COVID-19.
Okay. So, as I said, proteins are very important for, building immunity, giving satiety, improving metabolism. And sometimes, vegetarians don't, adequately focus on protein intake. So, everyone should have, at least one high protein source in each meal. Apart from that, we have been discussing about, complex carbohydrates. And in South India, we know that emphasis is a lot on rice. So maybe gradually people can start moving to red rice or brown rice, or there are so many millets, which are available in India. So maybe gradually, changing the eating habits, the thinking process, etc. For healthy fats, I would like to say that, focus on, invisible fats. So visible fat should be very less. The, oil or ghee used in cooking should be minimal. So people should try to take, healthy fats through nuts, seeds, avocado, or you have coconut, so restricted coconut as well. So, healthy fats. And people believe that, if they are not diabetic, they don't have any restriction on sugar. Even if they are not struggling with weight issues, sugar is not good, because, I believe that, if people eat a lot of sugar, then they are not going to eat a lot of fruits and vegetables. Maybe the choices would not be right. And I think, yeah, that's it. And apart from this,
Go for millets, because now millets are very popular, and especially in Karnataka, we know that millets are very popular here, and it is very good source for the proteins. So one should go for the proteins. And she also mentioned that when you are buying from the market any product which you consider as healthy, please see the ingredients written there, because many times it is misleading. So one should be very, very careful. Don't buy anything which is labeled as a healthy food. We should be careful and try to take only those things which are healthy, real healthy, and then only we can sustain ourselves, we can fight with the infections, because if we are healthy, then definitely our immunity will be more. Okay, now I would like to ask Dr. Hegde, what other natural measures can a person take to gain immunity, like exercise, yoga, which you have already mentioned? Any other natural measures you suggest in according to you, which we must follow now so that our immunity can increase apart from exercise and yoga?
Yeah, thank you, sir. Apart from yoga and exercise, the other natural remedies is actually we are from South, and we do have lot of herbs. So we can go for natural herbs like tulsi and locally grown other medicinal plants we have. We do call it as Amrita Balli also. And here in Karnataka, many local people know about the medicinal value of these locally grown herbs. So what I suggest is that a locally grown medicinal herbs can be used as a natural remedy to improve your immunity and fight against the infections also. And the other form is like you can use ginger got as anti-inflammatory and antiviral. And the one more important factor in this pandemic is the lack of sleep. So the other method is like if you go into more of a physical exercise or de-stressing yourself through relaxation and meditation, which will improve your sleep activity. So at least 7 to 8 hours of sleep is very much necessary for our body. If our body is not relaxed, the other bodily functions are impaired, and thus your metabolism is affected very badly. And if your metabolism is very much affected, your gut microbe is problematic, which is again a lack of absorptions of nutrients in your body. So what do I suggest is have a proper balanced diet, as everybody have suggested the proper locally grown items, lot of fruits and vegetables. You can use these locally available herbs and spices and condiments in your cooking, or you can make it in any other forms like in soups. You can make soups and you can have pepper rasam, which is actually a lot in South and Karnataka people do that. Rasams out of pepper, ginger, and garlic. So these kind of cooking may actually improve in fighting against the infections. And then proper sleep is one more important. Exercise, it doesn't mean only that you have to go into cardiovascular exercises or into your gyms or anything. Walking 15 to 20 minutes twice a day is actually more beneficial. Even walking inside the houses would make a more beneficial, because now it's a lockdown period and people cannot move out of the houses. So if you have a small balcony or anything, just do 10 to 15 walking straight in your balcony. That is actually improve your physical activity, and also your metabolism will be increased. So this is what I give a take home message for the viewers actually.
Okay, thank you, Dr. Hegde, for giving the message that according to her, apart from exercise and yoga, one should use the
Important factor to improve is probiotics. So we Karnataka people
very popular in dish in Karnataka.
Basically, became more popular when it was proven to reduce the seizures in pediatric patients. Now, it is all about, keto diet is all about cutting down the carbs and eating more fat. Now, the daily breakdown is like around 5% of calories are from your carbohydrates, okay, including low carbohydrate, non-starchy vegetables and small amounts of leafy vegetables as well. The keto diet excludes the carbohydrate-rich foods like, grains, beans, fruits, and starchy vegetables. Around, say, 20 to 25% of calories in this diet are from protein, such as your meat, eggs, curd, milk, etc., and cheese. Cheese as well. Then 75% of the calories are from fats, such as, oils, nuts and seeds, butter, and avocado. It is basically, this diet is basically designed to burn fat by cutting the carbohydrates. And, your body turns carbohydrates into glucose for energy. When you cut carbs from your diet, basically what, you switch to burning fatty acids or ketones, which is what it is called. Breaking down fats for energy is called ketosis, but it takes about a few weeks of carbohydrate elimination for your body to transition into the ketosis. One more thing I want to mention is, there are certain pros and cons of keto diet as well. Like for some people, it may help them lose weight in a very drastic way. All right. They're, on paper, basically burning fats by eating more of them is, enticing, which is why the diet has become more popular. The keto diet basically, allows people to eat the types of high fat amounts that they enjoy, such as, red meats, fatty fish, nuts, and cheese as well. There are certain cons to it, that is, it is difficult to sustain, like because there are certain restrictions to the diet. So keto diet is a little difficult to stick to for some people. It can be effective for weight loss, definitely used in a very short term, but say 2 to 3 months a person follows a keto diet, but then it is impossible to follow that throughout your life. Whereas coming to, once the person stops the keto diet for following it about for 2 to 3 months, next step is, they have to keep a very strict check on what they are eating and their physical activity. To maintain that weight, it is a little difficult for them. So keto diet is, not really advisable. Like, I wouldn't personally advise anybody to go for a keto diet, because, calorie depletion is there, and a lot of nutrition deficiencies also occur. Because it is so restricted, you're not receiving the nutrients like your other important vitamins, your minerals, that you're getting from your fruits, your legumes, dals, whole vegetables, and whole grains. Due to these, deficiency, people also report that they have been feeling tired or say foggy. These symptoms have been dubbed to, like the keto flu, how it is being said normally. So also, constipation might be one of the reasons if a person is following a keto diet. So that is my take on keto diet, basically.
Okay.
Also, one more thing I want to mention, like there are no such thing, like it may have an effect on your kidneys. A person might also, go enter hypoglycemia, because there's no proper count on their carbohydrates, on their proteins. They're just, it is a very high fat diet and less of carbohydrates. Also, it is basically an imbalanced diet.
Okay, thank you, Miss Malek. And she says keto diet is basically low carb and high fat. And there are advantages initially, because you will be losing weight, and it's very interesting to eat, because you will be eating whatsoever you like today for the food. But it is harmful in many ways. First thing, you are not getting proper nutrients, and secondly, it can even harm for the kidney, because you are using lots of fat in this. Thank you, Ms. Malik, for giving your views. And according to her, she will never advise anyone to go for keto diet, because you can follow for 2 but after that you have to come to regular, and then there's a lots of problem, because your body has lost the main components, that is nutrients, which we all require. Thank you, Ms. Malik, for giving your views about the keto diet. Now my question is to Ms. Ayyar. Ms. Ayyar, this fasting nowadays, it has become like somebody says that the fasting is very good, and in India, especially in India, we keep fasting in on the many festivals, whether it is a Navratri festivals or Janmashtami or Ganpati, many festivals. Do you think these types of fastings are beneficial for or not? If not, then why? And if yes, then why? Ms. Ayyar, please.
Uh, in Actually, this fasting, in one sense, we have a scientific diet, intermittent fasting. Normally, there is a dieting system, intermittent fasting. In that system, what we follow is 2 meals, and there is a 12 to 14, like that cutoff. And in that case, what we follow is we have to provide 2 meals, minimum 2 meals. And in other times, our body utilizes the accumulated fat in our adipose tissues. So that is no problem. But the most thing, what I said is it is not good fasting, because fasting and feasting, both these are not good for our body. Especially if there is any healthy problem, fasting is not good. Even in the spiritual or ritualistic path, if they have any health problem, the fasting is not good. And the main problem of these fastings are that will lead to gastric problems, because gastrointestinal problems occur due to this fasting. If we take a food and there is a long fasting time, that will produce gastric disturbance like peptic ulcer, that will lead to peptic ulcers like that. So the fasting is not good actually. And if there is no other health problem, if as a part of a spiritual path and for one day, that also I am not recommending this fasting. Really, I am not recommending fasting. Even though we have to take a small meal, that is good. Fasting will lead to, anyway, fasting will cause some intestinal problems. But this intermittent fasting like that, that is okay, because minimum 2 meals per day. For in the case of an obese person like that, we recommended intermittent fasting. But in the case of the spiritual fasting, that means a whole day fasting or 24 hours fasting, that is not good.
Okay, thank you, Miss Ayer. And according to her, if it is a intermittent fasting where you are having 2 meals, it is good, but that is also for a few, 1 day or 2 days. But if it is a fasting for 24 hours or more, no meals, then it is very harmful, because it will disbalance your food intake, and then it can be harmful for the body, for the intestine and other things of the, or it will affect other organs also. So it is not advisable to go for fasting. Even if it is a religious or spiritual thing, then please go for intermittent fasting where you can have at least 2 meals. Don't do the fasting from the whole day or the 24 hours. According to Ms. Sayyar, it is not advisable. Thank
Mr.
you,
Goel,
Ms.
I want to conflict the statement Mrs. Iyer has given. Actually, I being a naturopathy physician, we in naturopathy, we follow is the fasting. And we treat all the diseases through fasting. And our baseline concept is like morbid matter is one of the, toxic accumulation is one of the cause for all the disorders in the body. So I do conflict your statement saying that fasting is not important. I believe in fasting, and fasting improves your metabolic activity, and it also improves the other organ activities, and it helps you to put out the toxic matter from your body and cleanses. That is the detoxification process. So what do I suggest is, even in this pandemic, I do suggest people having fasting in a proper way. Take the guidelines from the naturopathy physician how to do a fasting. I do agree that in chronic conditions, you may feel sometimes difficult in fasting, but we even do treat the kidney disorders, doing fasting in a proper method. And there's a proper way to do fast. So take a good consultation from a naturopathy physician how to fast and how to break a fast. That's what I do want to mention on your statement, madam.
Okay, Doctor. Yeah, Ms. Ayer, you want to say something?
Yes, ma'am. Can you just give a small guidelines? How is the proper way of fasting? Can you just give us small guidelines about that? What is the proper?
Exactly. I just give you a brief, like how we do treat fasting, in naturopathy. It's like we ask the people, whoever wants to do a fasting, there's a detoxification process, to come into our centers, and we ask them to completely restrict from their other activities. So it will be only their physical activity what we are giving, and then the food what we serve. So usually we have 7 days of fasting, 14 days of fasting, where we give a clear liquids like jeera water, coriander water, tender coconut water, and every 2 hours in between we do give them this kind of liquids, so that they don't have any dehydration in their body. And early morning we ask them to have some yoga, and we have yogic kriyas, which again detoxifies your body. So we have a constant observation on a patient who is under fasting. We don't give them complete to dry fast. It's just something like you are restricting from the solid or solid food, what we actually mention is. So this is how we do. So that's what I said is, like, you do have to take some, a proper guidelines from a naturopathy physician, like how the fasting is to be done. If it is in a proper way, you surely get benefit out of it, and I can guarantee you this.
Yeah,
Thank
the
you.
main thing is
That,
a constant watching is needed. Uh,
Yes,
yeah, na?
exactly. A constant
Yes, and
observation and a
observation
physical
is
rest is very, very much
very
important,
much
and your
important.
mind will be clear.
Yes,
okay.
yes.
What
If
Dr.
you,
Hegde says that, yes, sorry. Yes,
but
you want to say?
in the case of diabetes like that, this fasting, I think if the patients alone will follow a fasting, that will have a negative effect also.
Yes,
Definitely, that
exactly.
is
This I do agree. Yes, yes. Any
So,
chronic inflammations or metabolic disorders, all alone cannot be done the fasting at home. You need to have a constant observation.
so basically what Ms. Iyer has said is that a fasting is not good. But what Dr. Hegde says, the fasting is good because it detoxify your body. But the only rider is that you have to come to the center, spend lots of money, spend your time with them. But we are talking of the religious fasting, because I know that I had a massive heart attack 4 years back, and my doctor in London, I was in London when the attack took place. And after that, he told me that you should have at least 5 meals. Never skip, never think for doing any fasting. Otherwise, you will again have a heart attack. So although you have mentioned about the chronic disease, etc., but do you think that if I will be under your observation or under your care, I need not to have any solid food, no proteins, nothing, only jeera water or the coconut water will suffice for a week or 14 days and I will have no problem? No, Dr.
never.
Hegde?
I see, sir. That is again depending on the condition of the patient. That's what I said. It's under complete observation. We do take the case study of a patient, like regarding the previous conditions, how their body reacts to this. And yes, what you said is there will be lack of protein, but enough of proteins are stored up in our body, so our organs are enough to release these energy proteins at the time of fasting, and actually your activity improves during the fasting. The metabolism is higher in case of fasting if you have observed it very clearly. And the other point is that you said on the religious fasting. Yes, religious fasting, I can't just say that it will be a proper method, because there are a lot of different religious fasting where everybody follows in a different way. Now some people in the morning they skip their breakfast, only one time meal in the afternoon, again night there will not be any food in the night. So these kind of fasting will harm your metabolism in your body. So that what I say is religious fasting would not be the better option, as always. But fasting once a week will actually gives you a very beneficial, but in this form, either in a liquid form, or you just have to be taking liquids full day. And the next day, the breaking the fast is one more important factor. Next day morning, early morning, if you go and hog with the puri or vadas, obviously it will just absorb all the oils whatever is there and increase your body weight, and it will again make upside down with your abdominal problems, and have nausea, vomiting, and all these problems. So fasting and breaking the fast is more important.
So what Dr.
So
Hegde says,
one thing,
yes,
sorry,
yes.
one thing I wanted to mention, like how your question was rightly said that, I personally believe we cannot ask someone to not to fast if they have this religious or spiritual belief. So what we can advise them is, before they start their fast, they can have appropriate amount of proteins and energy rich food, so that for the rest of the day when they are fasting, and how Dr. Hegre said that they are given certain, just to avoid dehydration, they're given some amount of water, jeera water, lemon water, something like that. So, in certain religion, they can't really have anything for, say a gap window of 10 to 14 hours. So what we can do is we can advise them definitely, like, to have good protein sources, like, for vegetarians, you can, they can have a good amount of dals, curd, milk, etc. And non-vegetarians can always have egg and chicken and meat and fish. So that is what I wanted to mention. That is, if they're willing to fast, they can. But then, what we can advise is just, a proper amount of food what they need to have before they start their fast.
Ms. Malik, what you said, yes, for one religion, we all know which religion you are talking. They always have a very rich food in the morning, early morning. and then they used to break their fast in the evening, that they will not taking a single drop of water. But
Right.
what about some other religions? We have one religion where there is not even, they will take water even the whole day, the 24 hours. Is it
Right.
correct?
So, no, first, that is what, sir. When they, like, for such people, we should advise them if they're not having it for that long period. So they need to have enough amount of water and food that they be
No,
having.
but that is not allowed as per the religion belief. That is the
Right.
problem. So we
Right.
have to understand one thing. What I could gather from you three discussing this point about the fasting is that if you are sick, if you are ill, you have any problem, please don't do the fasting without a proper under the
Medical
medical
advice. Right.
advice. Number one. Number two, even if you want to do fasting, go to a naturopathist. If he or she will advise, please get admitted there, spend some good money, and then you must go for the fasting. Don't do the fasting at home, or take the prescription from them what they should take. Or we should have what Miss Malik said, that we should have a rich protein diet in the morning or before starting the fast, so that at least we can have those proteins in our body, and we can sustain. And secondly, what Dr. Hegde mentioned, that we should have some drink some jeera water or coconut water throughout the day, which if it is allowed in the fasting. So one should understand that a healthy food, it doesn't mean that you can reduce, or you can do the dieting by reducing intake of food, you can become slim. No, it has to be a proper healthy diet, and that is only possible if you are eating proper thing like leafy vegetables, like fruits, and all those things which are giving our necessary vitamins and the proteins to our body. Now, in the last segment, I would like to ask all of you a very simple thing, that is your suggestions to the government. Because see what happens today in India, especially we found that lots of junk food are in sale. Everywhere we can see what is happening. And that's why the problem starts. And then we start, once the child become addict, then we start restricting. So we would like to know from you, starting from Dr. Goel, what suggestions you want to give to the government, and what advice you want to give to the public in a very, very brief, because we have a paucity of time.
Okay, so to the government, I would like to give two advice, that stricter guidelines for packaged foods and for foods which are served in restaurants in relation to hygiene, calorie and all. And to the public, I have two or three advices. Since childhood obesity is increasing, I would urge all caregivers, mothers, aunts and all, not to encourage overfeeding since childhood. Somehow, we have been so hospitable people that, we are very happy if, the children have overeaten, and this becomes a habit. So, it's very important not to encourage overfeeding. If the child is full, then, he should stop eating. Then be a role model for the children. Instead of saying that, you should eat fruits and vegetables, you yourself should be eating healthy foods, and automatically the child will learn about, healthy eating. And Kerala is, spice known for its spices. So, people can use spices and other ways of, cooking using less oil and all, to restrict the amount of, fried foods which is used maybe in South India and all over India as well. That's it.
And thank you, Dr. Goel. Yes, Dr. Hegde, your suggestion to government and advice to public. Short.
First thing I want to give advice to the government is to stress more on the nutritional awareness program, as we in Karnataka have got a lot of small villages where people are not much aware about the nutritional values, like what they eat and what is the proportion. So what do I suggest with the government is to have a lot of nutritional awareness programs on how important the nutrients are in our body. And to the public, I want to request is the first line of defense, as the government has already said, is washing your hands, social distancing, wearing masks. And the second thing I ask them is to have a nutrient dense food, It may be in the form of fruits, vegetables, leafy vegetables, nuts, the locally grown herbs, anything in any form. And the cooking method is also very, very important. So look into your cooking method. The dry heat and baking is actually the good method than going into a deep fried items and all these things. And make your breakfast as very important meal, because everybody tends to skip their breakfast, which is
Okay.
very much important for your glucose
Okay.
application to your brain.
Thank you, Dr. Hegde. Yes, Miss Malek, please. Please unmute. Yes.
Yeah, so as Dr. Madhu said, the government should actually stick to guidelines, and whereas nutritional label, as far as that is concerned, people really need to know what they are actually having, because in the front of the product, a different information is given, whereas behind the nutrition label is something different. So that is one thing. And Dr. Hegde's advice is absolutely correct, like, about nutritional programs. And, even in schools and colleges, we need to have, some amount of little, like, just a period of 40-45 minutes of, nutrition education, even in schools and colleges. Not just certain degree courses like how we have
Okay.
been learning. And
Okay.
secondly, sorry, we're running short of
Yeah,
time.
well.
To the public, I wanted to say that, eat healthy. That's all I want to say, and keep a check on what you're eating. That's all.
Okay. Thank you very much. Yes, Mr. Ayer, short, please.
In Kerala,
Please be brief.
in Kerala, our government follow very nice protocol, and also the only one thing is so many small restaurants are here. So my request to our government is to follow to give a guidelines about the hygienic practices what they have to follow. That is very important. And to the public, in my point of view, to the public is you have to follow a balanced regular diet, and introduce variety of food in your diet, especially the natural food. Parents also have to
Okay.
follow that,
Okay.
then the kids will follow that.
Okay, thank you, Ms. Ayer. So you have seen today the views about the experts, all the experts about the healthy diet during COVID-19, and they have given lots of good tips. I'm sure all of you will be beneficial after watching this program. And this program is brought to you live by V4 News, Global TV, Malnadu TV, News Gaon Se, Samvad Sarokar News, as well as it was shown live on Facebook and YouTube. And our endeavor is to bring new topics every day. And tomorrow is again a very, very important topic, which is COVID-19 impact on housewives. Yes, you have heard correctly. It's an impact on housewives. And our panel guests are Dr. Rajiv Anand, Senior Psychiatrist and Marriage Counselor, Mumbai. We have Miss Pooja Gumar, Housewife, Mumbai. We have Miss Sarita Vashne, Housewife, Meerut. And Miss Bela Arora, Housewife, Mumbai. So keep log in tomorrow at 10:30 a.m. on Media Conference with Lal Goel to watch this thing. And one more thing which we have now started is that Gyan presents healthy, tasty, easy recipes. Yes, today's program was on this. So you can very well see this program also, that is healthy, tasty, easy recipes, no sugar, no oil, by Miss Ruby and Miss Ranu. Learn to cook 3 vegetarian, yummy, healthy dishes for just ₹200. Cooking classes on Zoom on Saturday, 29th August 2020 at 3:30 p.m. For details, please contact 990-172-8861. I repeat, 990-172-8861. And one more program, Gyan Presents Workshop in Professionalism on Zoom on Sunday, August 30th at 12:30 p.m. Registration charge is only ₹200. For details, please contact 9844-182-044. I repeat, 9844-182-044. Thank you, viewers. Thank you all my guests, Dr. Madhu Goel, Dr. Prerana Hegde, Ms. Amenah Malek, as well as Ms. Ramaya Iyer, for joining us and giving so important views and expert opinions to our viewers. I'm sure they all will be beneficial with this. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.